Hi, welcome to Bending Towards Justice. My name is Bhavan Singh. I'm the Executive Director of the Oregon Justice Resource Center. Thank you for all of you that are joining us. Sorry for the little bit late start. We had slight technical issues. That was my own fault, not being very familiar with Zoom and the live streaming functions, but I think we're all set up now. I just want to welcome you to the second panel conversation that we're having on Bending Towards Justice. We started Bending Toward Justice in part because we wanted to use this week to help refocus and reground our supporters and people in the community on local issues after the election. You know, this past week and even now we're still very engaged with sort of the national conversation and national election. But on a day-to-day, week-to-week basis, it's really the local level politicians from the city, county, and state levels, and the policies that are enacted from these jurisdictions that really have the greatest impact on us from on a day-to-day and week-to-week basis. And so we really wanted to talk about issues that we're working on, civil rights issues, criminal justice issues, and what those issues mean for us here in Oregon. And one of the big issues that we've seen since the beginning of COVID is really this heightened recognition of the intersection between public health and mass incarceration. And we're really excited here today to have Oregon's Physicians for Social Responsibility alongside of us and participating in this conversation to talk about that intersection of mass incarceration and public health. For us, this has been an issue that we've seen quite a bit in how people with medical issues or how and other public health issues get exacerbated by the criminal justice system, and how we really, if we were to take a look at the criminal justice system or the criminal legal system through a public health or medical services lens, that we may begin to ask a very different set of questions about how we keep people healthy and how we protect people's well-being as they're going through the criminal justice system, which I think would help us rethink about how it is that we treat people that are going through the system. So that's just like a basic introduction to our conversation today. And so we'll just get started since we're starting a little bit late, but I just want to let the folks from Oregon's Physicians for Social Responsibility introduce themselves. So I'll just let them quickly introduce themselves and then we'll begin our conversation today.
I'll go first. Hi, everyone. My name is Yuvia Moreno, and I work as the Energy Justice Organizer with Oregon Physicians for Social Responsibility. We started working around Oregon state prison issues in May, or maybe a little bit before that, out of concerns for public health issues in COVID. And then we've continued to partner with Oregon Justice Resource Center. And so today we're going to share with you a little bit about our work and our findings. And I just wanted to say that through my lived experience and through everything I've read and all research, I actually did some projects in college and different things like that around incarceration. But I know through that knowledge and in my heart that mass incarceration is indeed a public health issue. Thank you.
Thank you, Leah. And my name is Ann Turner. I'm a retired physician. I previously worked at Virginia Garcia Memorial Health Center, a community health center in Washington, Yamhill County that serves a primarily underserved population. And a lot of folks dealing with immigration issues and the immigration justice or injustice system, if you will. And so I've been volunteering with the Healthy Climate Action Team with OPSR for the last several years, and really came to be part of attempting to address some of these issues with the COVID pandemic. But it certainly has been an interest of mine for many years, related both to the general criminal justice system as well as the immigration justice system. So, thank you.
I'm Catherine Bax. I'm a retired physician assistant. I've been retired about 12 years and have been working with Oregon Physicians for Social Responsibility as a volunteer on the Healthy Action Team since then. This is an important issue to me. I think right now, mostly because of the Black Lives Matter and the police brutality and the intersection with that and the public health, which is what I have more expertise in. It seems like a good fit. And so I'm glad to be here. And thank you for inviting me.
And hi, my name is Damon Motson. I'm the Healthy Climate Program Director at Oregon Physicians for Social Responsibility. I use they, them pronouns. And for those who maybe don't understand why we're working on this from our climate program, you know, one of the things that we saw really obvious connections between climate impacts and mass incarceration is when there was a big evacuation that had to happen of a number of prisons. And I'm sure we may talk about that more later on in the webinar, but we really focus on climate as a broad and intersectional issue at Oregon Physicians for Social Responsibility, and see this as a really important and urgent issue to be working on, especially as the COVID-19 pandemic continues unabated. And so glad to be here with you all, and I'll pass it off to Pat O'Hara, who looks like he is taking a moment at work to join us. Thank you for joining us, Pat.
Hi, my name is Pat O'Hara. I'm the board president of Oregon Physicians for Social Responsibility. I'm also a practicing general surgeon, which I'm gonna have to leave right at 1. I'll just warn you, because I'm on lunch in the clinic, and I kind of, my thinking around mass incarceration and public health has come from a really sort of general point and then really specific. So I read The New Jim Crow by Michelle Alexander, which really opened my mind to mass incarceration is a large issue, and I'm not going to get into that a ton right now, but basically, like, it's a huge health, being incarcerated is a huge health impact, and it's you know, mass incarceration is used as, you know, essentially a social control. So there's tons of people who are incarcerated who don't need to be, and there's a massive impact there. And then I work in Salem, and so I see patients from the prisons here in Salem and the state hospital. So that's given me some real personal insight. And then I was involved in a case I have a friend who's a criminal defense attorney who had a patient with pancreatitis who was incarcerated and was not getting treatment for it. And like testifying there, hearing what the doctors from the prison had to say was really eye-opening, because he was not, I mean, he was getting some appropriate treatment, but he was not getting the treatment he needed. And there was just no room for that. And then seeing like the lack of release of prisoners who are really at high risk of you know, bad complications or death from COVID, and who aren't, you know, a threat to society if they're not incarcerated. Like, I feel like Oregon has really been slow to do that, and that's been a failure. So I'm hoping that a health focus and health voice on some of these issues maybe can get some traction where it seems like we need it.
Well, thank you all for joining us. Like I said at the outset, we're really excited to be able to be in conversation with OPSR and to be able to talk about the intersection of public health and mass incarceration. Last year, or I think it's been over a year now, but our organization actually conducted a survey at the women's prison, in which we surveyed in total over 200 women, but in phases, about their experiences in the criminal legal system. And one of the issues that really jumped out was how these public health or medical issues do get exacerbated when individuals go through the criminal legal system. On the flip side, what we also found is that there's an opportunity that when people do get incarcerated, that there's an opportunity there to be able to work with people to help correct and stabilize medical issues that they were experiencing. So, you know, it is a balance that we want to strive to achieve, as far as making sure people get access to adequate healthcare and we're not exacerbating existing problems. But also, it could be the first time where people have some stability and opportunity to access healthcare where they haven't previously. So, you know, our whole sort of motivation for, again, collaborating and being in conversation with Oregon PSR is how do we bring public health and medical professionals to the forefront of our mass incarceration conversation? How do we allow public health and access to medical services help actually reframe the conversation and think about it and think about individuals more from a well-being perspective as opposed solely from a public safety perspective? And so just to start off the conversation, what would be helpful is if Damon, you're able to provide a little bit of background of what OPSR has done. People may not be familiar with the organization and some of the work that it's done and what its missions and goals are, because it very much seems to be in sync with our goals. And, we were very excited when we were able to, connect with you and work on these issues.
Sure, I'd be happy to. So Oregon Physicians for Social Responsibility is a statewide nonprofit. We have about 2,800 members statewide, and our whole reason for being is guided by the values and expertise of medicine and public health. We work to protect human life from the gravest threats to health and survival by striving to end the nuclear threat, advance environmental health, protect our climate, and promote peace. We're an organization of health professionals, but also public health advocates working collaboratively with community partners to educate and advocate for societal and policy change that protects human health at all of the different local, state, national, and international governmental levels. If you've heard of us before, it's probably because of some of our advocacy work on climate, or historically our advocacy work on abolishing nuclear weapons and nuclear demilitarization work. And we actually shared at the Nobel Peace Prize in 1985 for our work on documenting the impacts of nuclear weapons testing on health and well-being. And then again in 2017, we are members of the International Campaign to Abolish Nuclear Weapons, which won the Nobel Peace Prize for their work on a nuclear weapons ban treaty at the United Nations that was recently ratified. The United States and other nuclear armed states are not participating or recognizing that nuclear weapons ban, but it's important work that carries on nonetheless. And I really think one of the best ways you can encapsulate the advocacy work that PSR does is in the phrase, preventing what we cannot cure. So it became very obvious after all of our work on the nuclear freeze movement in the Cold War era, as we transitioned into the 1990s and 2000s, it became very clear that climate change was another enormous existential threat to human health and well-being that was something we had to prevent, because the alternative of letting it proceed unabated was too great of an impact on human health and well-being. And so mitigating and preventing climate change is one of the most important preventative health measures we can take on a public health level. And then similarly, when we started to see case numbers rising in care facilities, long-term care facilities, including prisons nationwide when COVID-19 broke out, it really raised alarm bells for us, because that is, something where fast action to prevent the spread of COVID-19 in close, cramped quarters inside of prisons felt to us to be one of the only things that that could meaningfully make a difference in stopping the spread there. And so it was quite alarming, as Pat O'Haran was saying just a moment ago, to see that we didn't release more than a few dozen Oregon State inmates to control the spread of COVID-19 in prisons. And so this is really, we've tried to be adaptable here and tried to jump in to weigh in on this issue as it continues to urgently impact the health and well-being of people who are incarcerated by Oregon State prisons. So I hope that gives a little bit of an oversight there on why we're doing this work. I think that, again, looking at also the evacuations from wildfires is a helpful way to connect the dots between the issues of the climate catastrophe and mass incarceration. It really, I think, pulled the curtain and revealed that we are not really prepared to protect public health and safety as well as we should be for when these climate catastrophes happen in our state. And so that was just yet another connection between the different areas of our work. And I think also we need to be thinking about the energy that we are reliant upon from inmates who do prison labor, and how we need to be thinking about our our labor systems in a much more humane way than to not properly compensate prisoners for the work that they do while incarcerated.
Well, thank you for that overview. I mean, it sounds like PSR has done a lot of good work, and in the community and even internationally. The values of peace and sort of restoration and prevention, I think, are all things that I think make a lot of sense to us. And even as we began to think about how to shift our conversations around mass incarceration, it is, I think, important for us to begin to use those underlying values that you talked about as ways to guide our conversation. So for us, we see the intersection between public health and mass incarceration clearly as sort of civil rights advocates or criminal justice reform advocates. But I wonder if you could explain, and I mean, you've already, all of you have touched upon this in your introductions and even in your comments here. But Yuvia, if you could talk about, like, what does mass incarceration mean to you and to PSR, and why should we think about this issue from a public health lens? If you can kind of build on some of the things that have already been spoken about.
Absolutely. Well, in my personal experience, my son's biological father was incarcerated for 5 years of his youth. And so I've personally seen not only the harms and when we talk about health, it's not just about your physical health, but your mental health, your social surroundings and things like that. And so I personally experienced the harm, not only the stress and inability to get medical assistance while incarcerated through my son's father, but also the stresses and financial burden and just all these things. Watching my son just, we were states apart, and so we only were able to see his father 2 times in 5 years. And so, just the devastation that it brings to families in that way. As far as, and then I have a social work background as well. And so in that work and in the research that I've done in college and has all just confirmed what my personal experience is, that, mass incarceration is hurting the individual that's held incarcerated. It's the staff, I believe, are being hurt because the conditions are often inhumane, and there's a culture of extreme punitive culture in prisons that I believe, not only are the people who suffer the back end of that culture, but also those folks acting out that culture are also being harmed. And they're taking that home to their families too. So I think and when we talk about public health, we're talking about social determinants of health. We're talking about poverty, and mass incarceration keeps our communities in poverty. We have to make really, a few years ago, there was a big effort to get federal prison phone calls, either, to make them affordable, because especially when you're calling out of state, one phone call of 5 minutes can be $20. When you're living in poverty, you have to make really tough choices of talking to your loved one for a few minutes, maybe a week, and paying a bill. And so, so the public health issues, it's a full circle around incarceration, and then the connections to incarcerated folks and mental illness and DHS involvement. All these things are things that mass incarceration contributes to. The United States is the leading, we incarcerate the most people. We do not have the highest population in the world, but we incarcerate far beyond what we need to be doing. And it's become, with the drug on war and really exacerbated incarceration, but it's been a problem since the beginning, in my understanding of, which really started after slavery was abolished. and convict leasing and a long history of brutality is what incarceration is. So all of that, I think, relates to public health and the work that we do at Oregon PSR.
Thank you. And I wonder if Anne, if we can build on what Yuvia had mentioned, if you're able to provide us your impressions of the criminal justice system and the importance that it places on public health and medical access. I mean, what are your impressions as you're coming into this issue, learning about this issue, and your understanding of this issue? Like, what are your general impressions of the sort of the priority and importance given on people's well-being from, again, a public health and medical perspective?
Yes, well, you know, when I think about the criminal justice system, it's hard to not, first of all, think about police brutality, particularly targeted at people of color, and George Floyd and Breonna Taylor and Eric Garner and so many others. And I worry about African-American parents in particular who worry about their sons being killed by police. And I think about our police here in Portland in response to the Black Lives Matter protest using tear gas and other harmful methods of control. But I think that really the crux of the criminal justice system, having created mass incarceration, is really such a huge issue. And like Pat, I really became much more aware of this when I read Michelle Alexander's book that was written in 2010, The New Jim Crow. And it was really the book that allowed me to understand that it was Nixon's war on drugs in the 1970s, which was a strategy to denigrate racial minorities, especially African Americans. And it was a reaction probably to the civil rights movement in the 1960s and the ploy of getting tough on crime. And does that sound familiar to anyone? And to make this happen, they did a lot of things that Bobbin can speak to more clearly than I can, but they paid local law enforcement to arrest people for low-level drug offenses, and they passed these harsh laws around minimum mandatory sentences and three-strike laws so that people are not only incarcerated, but incarcerated for long periods of time. And, you know, drug use among African Americans is about the same as among whites, but it's the African Americans in the community who end up being arrested. And so really my impression of the criminal justice system is it's yet another example of systemic and institutional racism, and that we really must address this as a society. And African Americans are really 10 times more likely to be incarcerated than white males. And if you have no high school education, your chances of being incarcerated are almost 60%. But in terms of public health, we have to think about the fact that the prison population has much higher incidence of HIV, of hepatitis C, and tuberculosis, as well as other sexually transmitted infections. Drug addiction and mental illness are also major issues. You know, in fact, deinstitutionalizing the mentally ill turned prisons and jails into de facto mental health facilities, but with no treatment provided to speak of. And with the incidence of chronic, in terms of the incidence of chronic illnesses, it's much higher in the prison population beyond HIV and hepatitis C. Also, the obesity epidemic and diabetes has really played out to impact prisoners as well, and especially in the minority communities. And this is with the long prison sentences. Oregon has a really high population of older people. And they're, of course, more prone to develop these chronic and serious illnesses. To something that Bobbin said, you know, I mean, some people do get, I believe it was Bobbin, are availed of treatment while they are in prison, which can be good, because actually it's one of the few populations in our entire country where healthcare is actually a mandate by law, as opposed to the rest of our society. But the quality of care, as Pat pointed out, may not necessarily meet community standards. And I don't have much direct experience with this, but I know that with the Coffee Creek project and others, I'm sure there are numerous examples of inadequate care being provided, and it may well be understandable in some ways, just in the fact that care for chronic illnesses, HIV and hepatitis C in particular, are extremely expensive, and people have no insurance coverage while they're in prison. So when people are imprisoned and they're ill and receive treatment, they are, may receive reasonable care, or they may not. But in any case, when they're released, even if they have applied for and received Medicaid, they may not be able to access a healthcare provider. And this may not be at the top of their list of priorities, because they need to find housing and food and a job. And then in some states, like 12 states, I think, have not done the Medicaid expansion. So many people in other states would just not have access to healthcare at all. And if they are able to access healthcare, they, in connecting with a provider, that provider would want to know what happened to them in prison, and getting their records is a huge issue. And that's one of the things that really needs to be addressed in Oregon, the fact that its healthcare record system is not electronic, it's not digital. And so providing those records is problematic and often expensive for the person. And one of the things that, I think that we have become aware of with the wildfires, but also just in general, that prisons are often located near waste facilities or other industrial sites. And so prisoners are exposed to significant pollutants, particularly air pollutants. And we definitely saw that during we were all affected by the same pollutants that were exuded by the wildfires this summer in Oregon. And as Yuvia pointed out, incarceration is not only an issue for the prisoners, but also for their family. When someone's in prison, they're no longer able to provide support for their family financially or be a parent. And also, as Yuvia pointed out, it may require huge expenses to stay in touch with a family member. So phone calls is one thing, but also if they're imprisoned in a place where it requires significant travel, then they may not be able to afford to do that. And then children suffer from the absence of a parent, and again may end up in the foster care system. And the stigma of having a parent in prison and other issues, emotional issues, really may affect their health and well-being. Then when a community has a huge number of people in prison, in and out of prison, it has to affect the health of the community as a whole. So to the issue of the social determinants of health, health outcomes in people in the US are well below those of other developed countries, despite our spending more money on healthcare than any country in the world. And yet we rarely think of mass incarceration as a social determinant, or incarceration as a social determinant of health. But we know that, for example, medical care really only makes up about 10% of what determines a person's health status, and really 60% is made up by social and behavioral factors, things like housing and education, income and employment, access to food, whether people use tobacco, alcohol, or drugs. So, but we need to add a history of imprisonment to that list, particularly in communities of color, because that issue alone affects one's access to employment, housing, and other social service resources. And all of these things affect an individual's health. And when a large numbers of people in a community experience the same issue, it becomes a public health issue, and it can't be ignored. So to improve the health of prison residents, we have to begin to transform the correctional culture to focus on humanity, dignity, and rehabilitation, rather than our current culture of punishment and suffering. So that is kind of my take on criminal justice system. I hope that wasn't too long.
Thank you so much. No, that was a lot there, and I think you connected the dots for us very well as far as how to be able to look at this issue more holistically and not, again, looking at it exclusively through a singular lens, but how all these different factors contribute to the well-being and health of individuals. And the cumulative impact of incarceration, not only on the individual, but on the family members and also the community at large, which, the follow-up question I have, and it can be for anyone to answer, and I'd love to hear from Pat as well, is what do you see then? I mean, you mentioned it towards the end as the biggest challenges of mass incarceration from a public health and medical lens. I mean, you talked about we have to change the culture of corrections, but what is the impediment, or what is, from your impression so far, like what do you find as the biggest challenges for us to be able to really move forward with a public health analysis around mass incarceration?
Well, so I've been thinking about this, and mass incarceration is a major public health challenge facing the US in the 20th century. And I really appreciate Ann's thoughts on that, on just mass incarceration. But some of the big challenges that I see in mass incarceration to public health and medical access are, one, that mass incarceration means that many more people than should be are cycling in and out of the prison system. We know that there are far higher rates of chronic health problems, substance abuse, and mental health, as Anne was talking, in people who are incarcerated or have been incarcerated. But also, there's a higher rate of chronic health problems, substance abuse, and mental health problems in the families and the communities of the people that are incarcerated. Thus, mass incarceration greatly increases the rates of these health problems in communities. You could say that the prison system is infecting the prisoners, their families, and their communities with chronic health problems and substance abuse and mental health problems. And not only is this cycling of masses of people through the prison system a challenge to public health, the sheer numbers of men and women in the prisons at any one time is a health hazard to the imprisoned and the people working in the prisons and the families and the communities of both. We know that overcrowding in prisons is consistent with increased stress, violence, and infection rates. And this, of course, is more terrifying with COVID raging. And but all these problems are in the system all the time. And also the prison system lacks the resources, not only the medical, but the educational and vocational and mental health resources to properly provide care for and support for the people in prisons. This also is amplified by COVID, and I think we're going to talk about that later. Prisons are not equipped to adequately address the serious health issues of the people in their care. Not only do prisons apparently do not have resources to provide the needed care to their population, I don't think that public health and medical care of the people in the care is a priority of the prison system. That's a public health question, is how do we make that a priority? Another challenge is the coordination of healthcare services between prisons and community health providers. It's basically absent now. And is there a process to coordinate the healthcare services and what that exists? I have not seen it working or actually read about it. And a glaring glitch that Anne pointed out is for the coordination of healthcare is that the Oregon State prison system, one of many states, doesn't even have an electronic medical records that they use for the prisoners. So I think the question for the public sector that I've been thinking about is, how do we get legislators and prison officials and society and the public health system to find the will and the courage, number one, to halt the mass incarceration, which is overwhelming the system, but more importantly, destroying the lives and livelihoods of hundreds of thousands of people and their families. And second, we need to demand and create a justice system that focuses on the health of people before they come in, part of this system, and once they're in the prison system, and also when they leave the prison system. I'm wondering if anybody else has any big public health challenges for mass incarceration that they want to throw in here.
That was very enlightening. I think the way in which you articulated, the challenges that as you see it that exist. And I'm wondering if, Pat, you could help us segue, sort of build on that conversation, and then help us sort of talk about the issue that you brought up at the outset around COVID and mass incarceration, and just, from what you've seen, you alluded to the fact like how that sort of how that sort of demonstrated or revealed that the challenges that we confront with mass incarceration and public health. But yeah, I'd love to hear your thoughts on it if you wouldn't mind sharing.
Yeah, so there's kind of sort of four different things I wanted to talk about. The two are about around the challenges, and I think there's really there's a personal sort of level there and a structural. And I think in the personal, a lot of it is the dehumanizing of people who are incarcerated. I mean, essentially, they're being judged for the rest of their lives on the worst thing they ever did. And I certainly wouldn't want to walk around with that, like pinned to the front of my shirt, and have that be the first question I'm always asked in any sort of situation. So the idea that they're felons or they're, prisoners or incarcerated, and I think we know that many or most people who are incarcerated will be out in our communities again. And I mean, I think, there's such a punitive philosophy rather than the idea that, people are incarcerated because they made a mistake, and rather than, having some deep character flaw. And so like seeing the humanity of prisoners, I think, is something that is lacking going forward, and a real challenge. And then I think structurally, I mean, obviously private prisons have a profit motive, and that's incredibly problematic. But even, I mean, for state-run prisons, there's a lot of, politically, there's a lot of scapegoating of especially the poor, BIPOC communities, and sort of law and order rhetoric to get the base out to elections, and we've seen it on both sides of the, both political parties in this country. Certainly in my lifetime, you look back to the Clinton crime bill, it's a lot of the same language that you're hearing from the current administration, and so so the most vulnerable communities get thrown under the bus for short-term political gain, as well as to take, I mean, I think we can't talk about this without talking about racism, but to take big chunks of the population, sort of out of civic life, and certainly out of being able to vote or run for office. So I think those are real structural challenges. I wanted to talk a little bit about the two other things I want to mention was sort of there's different lenses to look at this through, and one is moral and one is practical. I think it's important to use both. And so, I mean, the moral argument is fairly straightforward. Like, a lot of the way our laws are written, and certainly even laws that are written in a fair manner are not enforced in a fair manner. I think of doing stupid things when I was in high school and having a few minor run-ins with sort of the local police and it not being a big deal. Whereas if the color of my skin was different, I don't think that would have been the case. So anyways, I think like morally we need to do what's fair and right, and like to see people's humanity and care about them. And then practically, I think there's a real argument, even if you don't care about the prison population. I mean, I think COVID is a great example, but the other infectious diseases that I think Anne mentioned, like HIV and TB, I mean, if we know that most incarcerated people will be back out in the community at some point, like we're the medical community is trying really hard to eradicate TB, and if prisons are a place where TB festers and grows and it's a reservoir for it, that hurts everyone. If we can't eradicate TB because we have so many people incarcerated in poor conditions and people are spreading TB in prisons, like that hurts the entire population, both in and outside of prisons. Same with HIV. If there's poor treatment or spread of HIV in prisons, like that affects all of us. And I think COVID has been the most dramatic example because the transmission is so fast and it's such a severe disease. Like the prisoners, and maybe there's some exceptions to this, but in general, the prison population has not been protected from COVID, and they spread it amongst themselves and to the guards, and the guards are out in the community, and you're getting transmission back and forth. And so, and there doesn't seem to be, as well as with the wildfires, there doesn't seem to be much consideration about the well-being of the prisoners, but that has cascading effects. And so, especially around infectious diseases, there's a practical argument to, like, for instance, to have released a lot of prisoners who are susceptible to COVID before they got it, to reduce the entire population's risk of spreading COVID. I'll probably stop there, but those are some thoughts I had.
Well, thank you so much. I mean, we're at the back end of an hour, and I'm sorry that we started a little late, and that was my own fault for not understanding technology very well. But I think your last remarks, Pat, the way you kind of summed up this interconnectedness, I think is really important. And I think that is the reason why, as an organization, we're so interested in trying to bring a public health lens into the conversation and work with public health professionals, because unless we accept that interconnectedness and really act with that with that sort of urgency, then I don't know if we're ever going to get to resolve the issues in a way that makes sense. Because I think the importance of being able to treat and work with people while they're in custody and protect them is really about protecting our community in total. And I think, as you mentioned, COVID, I think really dramatically exposed that in a way that, made it very obvious for individuals. And, states around this country, including Oregon, I think are still struggling with trying to figure out how to manage the prison population in light of COVID. So, it is something that we're going to have a conversation later this afternoon with our civil rights attorney to talk about the litigation that we've been doing around COVID in the prison. So, we'll dig more into that. But just to, just as to wrap up and conclude, I wish we had another hour to talk about this with all of you, because the insight that you guys bring to this is just fantastic. I just want to ask, like, very simply, maybe Damon or Yuvia, you can answer this, is how do people reach out to you? How do people connect with OPSR? And what are some issues you guys are looking forward to working on in 2021?
Well, I can talk about getting hooked up with us as an organization, and then I'll pass it to Yuvia to talk about what we're working on in mass incarceration. And just one quick straight thought that I had, which is that I think COVID-19 has really shown all of us how interconnected our health is to each other, and how, and I think that one of the points that Pat's making is a really good one here, which is that when we view human beings as disposable, and we say we're going to lock people up away from society, that is really a myth. You know, that human beings are not disposable, and you know, just because folks may not be free to walk the streets of their hometown or home city does not mean that their health is somehow now not connected to the health of everyone else around us in the community. And so I think that just, you know, that really subtle shift in thinking about how no one deserves to be, you know, thrown away in that kind of a way, is a really important one. And I think that the public health model can help us to rethink that way. Getting involved with Oregon PSR, you can visit us at www.oregonpsr.org. And there you will find a wealth of resources on the work that we do and ways that you can plug in and get involved. One of the best ways to do that is to sign up for our email action alerts. And I put this in a comment for the Facebook stream. So if you go to our website and get signed up for our email alerts, we'll email you about once a week with different action opportunities to get more involved with us. And there's also just a lot of really interesting articles and information that we share with you in that format. I also encourage folks to follow us on social media. We have a pretty active postings on our Facebook, our Twitter, and our Instagram. At Oregon PSR is the way to find us there. And if you're interested in getting involved with either our peace work group or our healthy climate action team, you can send us an email at info@oregonpsr.org. Those are our volunteer teams of health professionals and public health advocates that work on issues like ending mass incarceration, climate action, and police reform and accountability. So I'll pass it to you now, Yuvia.
Sure, thank you, Damon. And then, so who you're seeing here is kind of the majority of our group at Oregon PSR that works on mass incarceration. So, you know, we're a small work group that we meet weekly with Oregon Justice Resource Center. But I'm happy to, if anybody's interested in trying to, you know, either meet with us or work with us, please do email me at lluvia@oregonpsr.org. That's my name, Yuvia, at oregonpsr.org. But, you know, we don't have any formal way of like joining this small group yet, but we do, if you get on our email listserv or join one of our other groups, the Peace Group or the Healthy Climate Action Team, we share all our updates through email right now because, you know, everything's electronic that way. Yeah, I did want to mention sometimes we get questions about specific cases and or if, you know, we do work with medical professionals, but we also work with, our membership is healthcare professionals. And so it doesn't necessarily mean physicians. And we do work with many physicians, but we don't have a coordinated way to support individual folks with any of the physicians we work with. So I just wanted to help clear that up in the community. We do mostly organizing and work in the community like that, and connecting the health professionals like in this webinar to bring attention to the issues that we work on. But we're happy, sometimes we get reached out about that, and then we connect you to Oregon Justice Resource Center, because that's part of our partnership, is that we don't provide those services, but we will try to find out who can support you, because I personally know, and as everybody here has said, that mass incarceration impacts a lot of us. And so, we understand that folks, and it's so hard. It's so stressful for families. You can often find little to no information about your loved ones that are incarcerated, much less their medical situation. And so our hearts are with you, and we do what we can for the community, but we can't really provide that individual advocacy at this point.
Well, I want to just thank Oregon PSR for being here and participating in this webinar. As I mentioned, the OJRC is very excited to be able to collaborate and be in conversations with Oregon PSR and thinking about how we can reorient the conversation again around community well-being, public health, and ensuring that people are protected and that they're able to realize their full potential and live a life of dignity in our community. And we encourage you to look at their website, follow them on social media, continue to follow us on social media. We're going to wrap up. We have another panel starting now that will talk about women working in civil rights and social justice space. But I just want to thank everyone for joining us today and thanking again Oregon PSR. And we hope to see you down the road and working on these issues. Thank you all.
Thank you, Bobbin.
Thanks, Bobbin.
Thank you.